Hello everyone, my name is Dr. Dave. I'm a licensed podiatrist and I would like to thank you for watching my video on my Frugal Foot YouTube channel. If you enjoy these videos, please hit the subscribe button. In this video, I'm going to discuss Morton's neuromas. Now, I'm going to use my foot model with the crooked toes here, and I use this in my office all the time. I work really good with it, so hopefully it will help you understand what Morton's neuroma is. First off, a definition. So Morton's neuroma. The word neuroma, it makes it sound like it's a tumor. It's not. I think a better word would be neuritis, inflammation of nerve tissue. Technically, a Morton's neuroma is in the third web space, so it's in there. Now, you can have a neuroma in any web space. In the first web space, it's called a Joplin's neuroma. They're very uncommon in the fourth web space. In the second web space, there's no name. So feel free to name it after yourself if you happen to have a neuroma in that web space. But when I refer to Morton's neuroma in this video, I'm really referring to any neuroma in between the metatarsal heads. Okay, so Morton's neuroma, what causes it? It's really important to understand the cause of neuromas, because if you don't understand the cause, you're not going to be very well versed in knowing how to treat it. So let's look at the foot here, and this foot is in the air. With the foot in the air, the arch is all the way up, and so are the bases of those metatarsal bones, those long bones here, okay? Since the bases are up, the heads of those bones are all down. Now, this is normal. This is the way it should be when your foot is in the air. Now, when you put your foot on the floor, you have to absorb shock. So when you strike the floor, the arch is going to go down. And when the arch goes down, those bases of those metatarsals go down, which means the heads of those metatarsals are going to go up relative to the bases. They're still on the ground. They're just going up relative to their bases, okay? So the arch goes down, the foot kind of flattens out. This is how you absorb shock. That's normal, okay? Now, when you go to step forward, you don't want that flexible foot. You want a rigid foot. And so as you start to lift the heel, the arch starts to come back up. And you want that arch to be all the way up before you leave the ground, because that makes your foot rigid. It lowers the ball of the foot to allow you to bend your toes over them so you can step off the ground. That's normal biomechanics. Now, this is really important, and I want you to see this, so I'm going to hold this up close, and hopefully you'll be able to see this real well. When the arch is up, and the base of the metatarsals are up, and the heads of the metatarsals are down, if we get those toes out of the way those metatarsal heads should look is pretty much just like that. The first and the fifth metatarsal heads should be the lowest. The second and the fourth should be the next highest, and the one right in the middle should be the highest. Okay? That's how it should look when your arch is all the way up. But when you bear weight and your arch goes down, all those metatarsal heads, they become flat on the floor. When you go to step forward, though, you want that arch to be back up again. We already discussed that. And when that arch is all the way up, you recreate that situation when you have the first and the fifth on the ground. If your arch is still down for whatever reason, maybe you are out running and you're bearing more weight and the arch is down longer, or maybe you're on hard concrete floors, or maybe you put some weight on, whatever reason, and the arch is down longer than normal, it's going to take longer for that arch to get all the way back up, and you may not get your arch all the way back up before you leave the floor, which means now those metatarsal heads might still be flat on the floor like that. And if that means that all the soft tissue structures that are around those bones are being driven down into the ground, including the nerves that are in between those metatarsal heads. So you have this nerve tissue, and it looks usually like angel hair pasta. It's really, really thin. It's really hard to find sometimes when you're in surgery. If it's normal, it's very hard to find these nerves. They're very, very small. And the nerve hits the ground over and over and over, and it's not supposed to. And what happens to that nerve? It becomes inflamed, and it becomes swollen. That's neuritis, okay? And it causes these symptoms like maybe you have burning or tingling or sharp pain, and then it gets larger, and you feel like you're walking on a stone or a pebble in there, and you can feel it clunking around. A lot of times the doctor will stick his finger and go, "Does that hurt?" And you go, "Ah, yeah, that really hurts." Well, that's because he's pressing on the nerve and it's swollen. He can move your metatarsals around, and it'll clunk around in there. Those are typical signs and symptoms of Morton's neuroma, or neuroma in any of those web spaces. Okay, so that's what causes a Morton's neuroma usually. Now, there are other exacerbating factors such as hammer toes. I mean, if you have a hammer toe, you have a crooked toe like that, that's going to push those bones, those metatarsal heads down further into the ground, and that can complicate things as well and make the problem a little more difficult to solve. So that's what causes Morton's neuroma. Now, just because you have some of those symptoms and you may suspect that you have a Morton's neuroma doesn't necessarily mean that you have one. And that's why you have to go to your doctor to get these things checked out. I mean, you could have capsulitis of the joint. You could have a stress fracture in the bone. You know, you may need an X-ray to take a look to make certain there's nothing wrong with the bone. There's other diseases involving the bones in here that need to be ruled out. And so I strongly recommend that you have these symptoms. If you don't yet have a diagnosis, go see your podiatrist and get checked out, have them take a look at this and give you a proper diagnosis. Now, once you've got this down, then you're ready to go forward and look at treatment. That's something that we need to discuss further, and that's going to be a separate video in itself. This is just a short video, a concise video on what Morton's neuroma is. Hopefully you learned something valuable from it. If you did, please give the video a thumbs up. I'm Dr. Dave, and I'll see you on the next video.